what's really chilling about these mass murders, which is what the authors in Mayo Clinic Proceedings are writing about, is that these things happen even despite all of our efforts to stop them. And unfortunately, I think history will tell us that a determined killer will kill, no matter what we do. And that's terrifying. It's also worth noting that while these events, when they occur, are very dramatic and very scary and very newsworthy, that they're really not very common. This is not just an American phenomenon. There have been mass shootings in Britain, in Norway, and in Germany, among other countries, all of which, most recently Kenya, all of which have, except for Kenya, have very strong gun control laws in place. We say to ourselves, well, we'll just register all the mentally ill and we'll solve this problem. First of all, it won't solve the problem, and secondly, we don't have the capacity to do the very thing that we think will make us feel better and safer. Three different populations here. There are people who kill themselves, there are people who kill someone else close to them, and there are mass murderers. The article is specifically about mass murderers. The literature says that taking guns away from suicidal people prevents suicide. Even if we were to register all the mentally ill people in the country, isn't prepared, it's not efficient enough to even keep track. Right now, states can opt out of registering their mentally ill folks. Probably less than a tenth of the people in the country who are mentally ill are registered, and these are people who have been committed. So they're people who have come to attention in a way that requires them to have court intervention, and they're not registered because we don't have the system in place to do that. These mass shootings are carefully planned, and they're planned over weeks, often, or months, and there's plenty of time for someone to get a gun somewhere, because guns are everywhere, they're very easily accessible. The literature, much to my surprise, says that the vast majority of people who do these kinds of shootings are not in fact mentally ill, or it's recognized after the fact. Mentally ill in this case refers to people who've been adjudicated by the courts to be committed for some kind of treatment. So we're not talking about a depressed neighbor. We're talking about someone who's come to the attention of the court system because of the degree of mental illness that they have. And it's actually a very large number of people, the vast majority of which who are not dangerous. So there's the issue of, first of all these people, and secondly, figuring out which one among them, or 5 among them, is going to be dangerous. We don't have the technology to do that.